Did you know someone has a stroke every 40 seconds? And every 4 minutes, someone dies as a result of a stroke. Dr. Rocco Ciocca is here today to talk about one area in your body that can trigger a stroke and how to reduce your risk. Dr. Ciocca is the Director of Vascular Surgery at MetroHealth. Welcome back to the show.
Thank you very much.
Now, you say strokes can actually be prevented, really?
Yes, that's very true. I mean, many strokes are secondary to certain risk factors. Some of them we can control, one of them we can't, which is age. But the other risk factors we can very much control. First and foremost is smoking. Second is high blood pressure. Third is diabetes, which obviously can't be cured but can be controlled. And the last is high cholesterol.
Okay, and you said age, which you can't control. Is there a particular age where the risk increases?
Well, to some extent, that yes. We tend to think of people over 60, although at MetroHealth we see many patients who are a good deal younger than that in their 50s.
Oh, dear.
And certainly someone who's 50 to 55 with the associated risk factors, one should be concerned about the potential for stroke and coronary artery disease and peripheral vascular disease.
Okay, so if you haven't addressed those factors, these plaque blockages, right? That's really what's causing the stroke. But we're focusing on a particular kind for today, and that's one that is in the carotid artery. Right.
There's a myriad of reasons that people can have a stroke, but we do know that 20 to 30% of strokes that we see are secondary to blockages in the carotid artery, and I think there's a graphic of that. The carotid artery is the main blood flow to the brain, and right where the blood vessel bifurcates, and there's again a graphic of that, plaque can develop.
Okay.
And in addition to narrowing the blood flow to the brain, more importantly what can happen is little bits and pieces of that plaque can break off and can travel up into the brain, and that's where the damage is done. So
how do we find out if there is such a blockage?
Right. Well, again, history and physical exam is important, and doctors, again, clue into the risk factors that we've just discussed. On physical exam, you can actually listen to the neck, and I just did it really just a few minutes ago in clinic, and you can hear sound. That sound is called a bruit. It's secondary to the turbulence from that blockage.
Oh, all right.
But then the other good news is we have a very good non-invasive test, an ultrasound, which can really give us very good and accurate images as to whether or not there's a significant blockage.
Okay, but what if there is a blockage? Then what can you do?
So if the blockage is very significant, and statistics have shown that a blockage greater than 70% is what we do tend to worry about. First and foremost, we modify the risks. So we sit down and say, listen, you got to stop smoking, you got to control your blood pressure, you should be on an aspirin or an antiplatelet agent, you should control your cholesterol, you should get into a good exercise program and diet. If, in addition, particularly if the patient is a good surgical risk, then some consideration for an operative intervention should be discussed, and that operation is called a carotid endarterectomy.
Okay, we got a picture of, oh, so you go in, kind of clean out that plaque, and
we do.
Open up the artery.
We make an incision in the neck, and we dissect the artery out. The artery is not very deep in the neck. We tend to do this, I do this under a general anesthetic, and we actually open up the artery, clean it out, and we patch it. And
you're good to go for how long?
Well, you know, again, statistics show that patients who have a successful operation do exceedingly well, and their stroke risk drops dramatically for the rest of their life. Oh, at least as it pertains to that artery. We obviously follow the other artery. There are two.
Right.
But patients tend to do quite well, and the outcomes, particularly associated with good risk modification, are very, very good.
That's great. It's good to know that this incredible surgery is an option for treatment, but as Dr. Ciocca recommends, do all you can to decrease your risk of stroke so it doesn't need to be an option. And if you're at risk, be sure to be screened. My thanks to Dr. Ciocca for joining us today. Thanks.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org. Next.